Hi, this is Michelle from Movement Lesson. I'm here to go over army crawling. It's a guide to understanding army crawling and atypical development. I really want people to realize that there is only one type of crawling, and that's a crawl, right? You're coming into sitting from the back, you're going into all fours and out of all fours, and now you're going into a crawl from a nice horizontal and vertical positioning, and you're crawling off. When children have not gone through their developmental milestones in the most optimal way, right? You get more atypical. And atypical or army crawling, as you're going to see here, is really because your child's rolling onto their belly and then trying to get up that way, and they can't get too far. So as far as they can go, but they still want the locomotion, they're doing an army crawling. This is an optimal, this is atypical, and you shouldn't settle for army crawling because, again, you don't have a good foundations in the other milestones. So please be careful when you listen to other people saying it's okay to have all these different types of crawling. First of all, did they evaluate your child? The answer is no. That's why you come to Movement Lesson, because for free for Facebook, or I do Zooms or in-clinic sessions, I can evaluate your child to tell you where they've missed in their milestones. Two, are you listening to most standards? Most standards, guess what? In the US, army crawling or any kind of crawling is not considered a milestone. So as far as they're concerned, it's not atypical because it doesn't even count for typical development. And so you have to be careful where you get your information from, but also who is evaluating your child. But to say that Tommy was fine and Tina was fine, and now therefore you should be fine without any kind of evaluation with your child for movement, then that's where the game is on, but it's in your hands, and you have to be careful about that. So army crawling by definition is basically belly's not getting off the ground. They are sort of pulling. It's a locomotion. It is not a true army crawling. If you look at someone that is in the army, they wouldn't crawl. This child is barely sort of dragging some legs. They're fine as far as their social skills goes and the eye contact, but this child is basically pulling themselves across the floor, and it's considered army crawling. Please, guys, this is about movement awareness, right? As far as if your child needs any kind of medical or hip dysplasia or anything like that that needs to be evaluated again by a professional, please do so. If you have any concern for your child, you go to your pediatrician. There's medical, it's very important, and there's movement, and then we all have to work together, right? But I support, and by all means, I'm probably the first one to say, the doctor is that way, but please, this is for your movement advice. And again, if I haven't evaluated your child or nobody else has, please do not use this as fine or not fine as far as your child. So when your child is curious, but they can't get off their belly, right? What happens when they can't get off their belly? Their movement starts going out in all directions, but most of all, they're being forced down. They can't go up, so they're going to stay down and they're going to go across. It's a very difficult way to be. If you don't believe me, get on the floor and try it. It is not easy. Whenever you question your child's movements, do it yourself. The old saying goes, it goes a mile in someone else's shoes. It shouldn't be that much work to be a baby. If you need help and you want to start with your optimal development, by all means, that's what we're here for, movementlesson.academy, and we'll go from there. Okay, do they fall to their belly? Okay, or do they get the toy and roll to their back? So this child is going in and out of sitting. You think they're fine, but they're not coming into sitting through their backs. They're doing it through their belly. So there she is. She gets a toy, and what she's going to do, because now she can't get back up into sitting with the toy, bam, she's on her back, right? It gives a very elongated period of horizontal development. And again, her eyes are separating from her body and through the toys. You don't want to see that with your baby, and they're struggling to go into the next levels of development. As long as your child wants to go down, right? You encouraging all you want for the crawl, the walk, and so forth. They're learning how to go down more than up, and you really want to catch that ahead of time, right? Does your child rolling to their belly versus coming to sitting, right? If they roll to the belly and they don't get up, this is where you get the army crawl. In some cases, it's a real heavy head. This case, bottom up. It could be bottom up, it could be head up. It all depends, but they're not getting their whole head, body, everything up into all fours, right? One of the things that you probably didn't miss is your child is sitting but without crossing a midline. When they're sitting, right, and you can say, hey, Michelle, I've got independent sitting, is the quality there? This child does not have a pubic bone strike. The pelvis is tilted, what that means. They're here. Is it hard for them to get toys? Are they basically saying, come here? And then also when they look up, do they fall back? Right? Well, that's part of, again, the eyes aren't crossing midline. So the head goes back to see and they're back and they're doing that. All right. These are things that, again, you think you have sitting, but the quality is not there in your sitting. Right. And so, again, this child here has really no midline crossing whatsoever. Again, eye contact, I get all that, but we're still looking at the movement. And this child's going to continue to struggle, right? So that's where you want to work on with your child, right? Your child should be able to cross midline. They should be equally to the left and to the right, right? They can work the room. They can get a toy from the left to the right and all this and these kind of things. And that opens up their bodies for all of those kind of things, the independence that they need for both vertical and horizontal. Right? So you can see here the difference between this child. See, they can look back, they can look around. The pelvis is nice and engaged, right? Come to sitting through their back, and they're all of this. They can just work the room. That is, again, a big difference between this and this child who's just sort of plopped in, more so like a beanbag, right? And so since the vertical can't be crossed, they are bouncing and you see the activity, but you're not seeing the successes like you do with this child, where they basically have movements almost 360 degrees. Right? The difference that this child's getting cognitively from their world versus the other child also too needs to be noted. The awareness, the long vision, the pubic bone strike, all of these things. The baby too is dragging a leg behind possibly. When they're dragging the leg behind, now you've got the force of movement, one going away from the body and one going through the knee. It is much harder to engage when the movements are going in two different directions, trying to get up into all fours, trying to get up into standing, because they're learning a big variations of moving of down and then up. And it confuses versus, going into both areas of the body going into that. So again, even the quality of army crawling is not the same. Especially the worst would be really dragging the legs from behind. So again, the complications of one leg behind, right, is again, your baby, I can tell you right now, didn't roll over in both directions. They only did one side. They kind of have a stiff leg, or we are starting to say they have a preference, these kind of things. And I can tell you right now, they did not grab their feet. The pelvis just isn't opening up, and you're just seeing that very limited movement. And so they have to work so hard in their bodies. They're not playing with the toys. They're not going into the social stuff and the language skills. And by the way, language is not just, mommy, daddy. Language is that pause and effect and be able to concentrate on something and look at something and see it and say ball. And when they're working so hard in this kind of positioning to go into that, and the stress level that they have is just not right when you're saying that this is a crawl and going into here. Again, complications that you might see of army crawling in future development, right? They will have difficulties with atypical, that's a fall. You don't want falling in babies. Babies are capable of falling. They're not organized to fall. They might be delayed in coming to standing. There's a higher risk of pulling to standing versus standing up. Pulling to standing is also not a milestone, just like army crawling is not. They might end up having dyslexia or have reading difficulties because, again, they're not reading, and all that crawling would have come from. And they're a higher risk for sport injuries, coordination and balance issues, or even playing sports. They might always be like this, the clumsy kid, right? And you don't want the clumsy kid. You can see this. Look at this. This girl has eye contact. I'm not worried about her cognitive, but her movement is not optimal. Boom. And she's falling down. It's okay to fall down when you're 6 inches off the ground, right? When you're 5 feet off the ground, it's not so pretty, and it's not the way we want to be, right? And that's very hard. Crawling should look like this, bam, going right into all fours from sitting, and they just go right in. They have a visual midline, and that is a crawl. right? When they can go from sitting and right and see this belly doesn't even hit the ground. There's no even risk of the child going into an army crawl. If you know the child, I don't know the age of the child, it is a baby. It's not a 2-year-old, right? These are skills that your child should have. So we have support programs as little as $10 a month, but please, you really want to get probably into our fast track, but we also have individual courses like on crawling, right? We and your goals are milestone progression, independence, and a plan for development. If you don't know what your child should be doing, you don't have a plan. You're waiting for your child to figure it out, and they might, but they might not, right? Or again, is it optimal? That's what we're here for. That's what you're here for. We're here to help you. We're the only one out there with a live Facebooks, and we have a group, private group, Movement Lesson for Parents and Practitioners to help you. Our support programs, many of them offer Zoom support and one-on-one as well as group events. You can go through the progressions of the milestones, but basically start today. If you feel you have concerns or worries, that means your child, in your eyes, is not going for optimal development. There are glitches, maybe from minor delays to major delays. You also have to remember too that the US government is offering you more so atypical. They're saying it's typical, but it's more so atypical development. They're missing a lot of milestones at crawling. And this is where the confusion comes in because you've got crawl and you've got no one to look forward to as far as government or state agency supports. That's what we're here for, is to fill in the gaps of development and help you every step of the way. Thank you. Anything that you need to know about your child's development, please go to Movement Lesson, movementlesson.academy, Movement Lesson for Parents and Practitioners. And we are here to help you with the largest library of working online with the human body. And we work with everybody, but we're a specialist in infant development. Thank you. But again, the crawling course, and we're here to help. Look for everything there has to do about movement and development at movementlesson.academy.